This talk is on the state of resistance training presently, and it's titled appropriately, Smart People Doing Stupid Things. It has to do with the misinformation that surrounds strength training at this time in our history. It's an important topic because of the state of our population. We have an aging baby boomer population. As of 2012, 23 million people were going over the age of 65. This will increase over the next 20 to 30 years to the point that there'll be 83 million people over the age of 65 in 2050. The importance of this is that there's an inexorable loss of muscle tissue and bone tissue as we age, to the point that people lose up to 40% of their muscle mass by the time they reach the age of 80. This bespeaks a epidemic of frailty in our population, and this frailty has downstream consequences in that it leads to the loss of independence, the need for nursing homes, and it is a problem that can be treated with appropriate resistance training. Appropriate resistance training has been previously well documented and is well established in the literature. The seminal article was Progressive Resistance Exercise, done by Dr. Tom Daylor-May back in the late 40s, and he established principles of progressive resistance exercise, and these were taken to the general population and brought out and actually began the fitness club movement in the 70s and 80s. As we approached the 90s, though, there was a backlash to this, mainly because people wanted to promote their own recipe, their own secret formula for fitness, and by doing that, they leveraged it against existing fitness equipment. And now we have a wide spectrum of ineffective activities being done in the name of resistance training. While these work well for individuals in their 20s and 30s, where they jump off boxes or do mud runs and throw medicine balls against walls, this is not something that we can apply to our aging population. And the mess getting mixed. I think it's important now that we provide our aging population with a rational way to achieve resistance. And it's just not that hard. Basically, we've taken the 4 physical capacities that you can train, and each one has its own set of requirements for achieving the optimal amount of capacity that you can attain. The problem comes in these other reputed methods of strength training that combine the two. The simplest one to is endurance activity. Basically, any activity done repetitively for some duration of time will result in fatigue. And you can basically choose any activity you want to do it for a prolonged period of time, and you will develop endurance characteristics, and you can gradually increase the time that you do it, and that will increase your endurance capabilities. There's some specificity in that your endurance is probably specific for the activity that you do, but generally it's an easy thing to achieve. A much more well-established capacity is neuromuscular training or motor control, and this is well chiseled into the laws of physical training, that it is the law of specificity of training. If you want to do a task, a physical task, and be better at it, you need to practice that task. And it's been done for years with the batting cage with baseball players, the driving course with golfers, is you do that same task over and over again, but you have to do it exactly the way that you want to perform the task. And so any variation will not improve that task. Probably the least requirement is is the physical characteristic of joint range of motion. Multiple recent studies have shown that although stretching has been promoted for a number of beneficial reasons, stretching really doesn't improve performance, it doesn't decrease injury, and in the healthy individual doesn't promote increased joint range of motion. Now, if you have an illness or an injury and your joints lose range of motion, stretching exercise can restore it, and certainly a regular stretching program can prevent some of the joint range of motion decreases that occur with age. Those three capacities are well established. The one with the most complexity is strength. And there are basically just two principles of strength training that have to be satisfied for it to be effective. One is that it has to come from progressive resistance exercise. Now that has a couple of nuances to it that are important. In order for an exercise to be progressive, obviously you have to do it in multiple bouts for a period of time, generally no less than 6 to 8 weeks, preferably for longer periods. But the other aspect of progressive is that you have to repeat the exercise in order to get the effect. You can't merely do any exercise and vary it wildly. You're not going to get the same reproducible effect. So one of the foundations of progressive resistance exercise is that the targeted muscle be reproducibly loaded during the exercise. The other aspect to this is that you have to have a certain level of effort. Just using the muscle alone is not going to trigger the effect to strengthen the muscle. So there's a certain level of effort that's necessary to get the muscle to respond, and then to do this sequentially over a period of time, and those are the underpinnings of progressive resistance exercise. Strength comes when you increase the number of contractile proteins that produce the force. These are the well-known actin and myosin molecules, and basically when you have more proteins in the muscle, more of these contractile filaments, then if you pack it in the muscle, the muscle is either denser or it's a bigger diameter. And that means in physiologic terms that you've increased the physiologic cross-sectional area of the muscle. You can't increase strength unless you increase the physiologic cross-sectional area of the muscle. Now, you might increase the efficiency of the task you're doing through neuromuscular training, but true strength can only be increased by increasing the contractile proteins and making the muscle denser or bigger. So one question is, if I have to get a certain level of force in order to get this effect, what is that level of force? Well, physiological examinations have shown that in order for the muscle to send the proper signal for training, there has to be some strain of the molecular chains that are contained in the muscle itself. And when the force the muscle exerts against causes this strain of the elements of the muscle itself, that sets off a signal for increased protein synthesis of these protein polymer chains. So the concept of a threshold level of force is introduced by this physiologic condition. So there's two times when the overload signals occur. If you're exerting the muscular force against a weight, and the weight is sufficient enough that in order to overcome the inertia of the weight and then finally cause movement of the weight, that there is some straining of the molecular components of the muscle, that occurs during the concentric activity, and that's a signal for the muscle to increase its protein synthesis. On the other end, if the muscle is static and then a load is placed from the outside and loaded onto the muscle, then the muscle, in trying to resist this, stretches, and you get the molecular strain, and there's increased protein synthesis. Those two conditions must be satisfied to get true strengthening. So, knowing these basic principles of progressive resistance exercise, we look at some activities that are promoted as strength training exercises today. A very popular one are body weight exercises. And body weight exercises can induce some fatigue, but they lack the necessary characteristics of progressive resistance exercise. There's no progression of the resistance over time. In other words, the muscle may adapt, but it's not going to increase if you're using the same resistance level at all times, and almost invariably the resistance level is too low to get a strength response in any case. It's likewise, using elastic bands on large muscle groups is an insufficient way to stimulate the physiologic cross-sectional area of the muscle. Now, there are high resistance activities that are promoted, and these high resistance activities generally involve multiple muscle groups, and if you start increasing the intensity of exercise in this way, that you also fail to satisfy the conditions of progressive resistance exercise. The larger muscle groups, in this case the gluteus maximus and the thigh muscles, are imposing their force on the low back in this case, and on the hands, and so there's a mismatch between the force production, and the smaller muscle groups prevent the larger muscle groups from attaining their true stimulus. Obviously, these activities with awkward lifting postures and sudden force production are very prone to injury. So this is not smart weightlifting, this is just plain stupid. So the answer is that there is no magic, there's no secret. Old school progressive resistance exercise with an effective level of resistance and done for a known period of time over a full course of treatment is going to result in the physiologic result that you want. And then you just repeat that over and over again, and the condition of frailty can be avoided in anyone in a very simple, safe manner.